If you watched my last video all about fertility testing, the basic workup, now let's talk through the scenario. If all those tests come back normal, but you've been trying and you're under 35, it's been over a year, you're over 35, it's been 6 months, or if you're over 40 and it's been 3 months, regardless of the fact that all these tests came back normal, we know human reproduction is extremely inefficient. I need to put that on a t-shirt because I say it 50 times a day. So we need to recommend treatment to get you on the path to pregnancy quicker. And there are really two major buckets of treatment that you can look to try to improve upon the inefficiency of human reproduction. The first bucket is a more laid-back, low-tech treatment option where we're basically gambling. We're trying to improve the odds on both the sperm side and on the egg side because we don't really have a target to treat. But we know that by giving you a medication like clomid to help you potentially release more than one egg, we're increasing the odds that at least one of those eggs might be healthy, genetically normal, and able to turn into a pregnancy. But we don't just focus on the eggs, we also focus on optimizing the sperm, and we do something called an insemination where we wash the sperm and we inject it at the top of the uterus after it's concentrated. So we're essentially just trying to create a situation where more sperm and more eggs can interact, and you're getting a few long shots in one cycle. I say a few long shots because ovulating one egg in a given month and hoping that it turns into a pregnancy is kind of a long shot, which is why getting pregnant is often a game of persistence and effort over many cycles. Typically in your 20s, even then we're saying, okay, there's a 20 to 25% chance that one ovulation could actually turn into a pregnancy. So by doing medicated IUI, that's what this is called, you're just giving an extra little push, but in reality, it's probably only improving your chances by a few percentage points. Typical per month medicated IUI success rates hover in the single digit, maybe the low teens. So it's really important to have that realistic expectation that you're in it for the long haul. You might do this for 3-4 months, maybe even it's acceptable to do it for up to 6 months. But if it doesn't work at that point, it's time to move on to the second treatment option, which is IVF. Now, it's never wrong to go straight to IVF. They are two very different treatment options. Unlike medicated IUI, which is less efficient, it can take several cycles to get there, you might not get there and you might have to move on to IVF. It is more high-tech and associated with a faster time to pregnancy. Going back to the medicated IUIs, the other downside is that you can't do any sort of testing. This is all just happening in your body, so you're not modifying the risk of miscarriage. But with IVF, there is this opportunity to create embryos outside of the body, and you can biopsy them and send those samples off for testing and identify which embryos have reproductive potential, and you can weed out the ones that would be sure to not implant or would be at a higher risk of miscarriage. And that's really important, especially for women as they get older than 35, especially older than 38, because at that point there starts to be a major uptick in the proportion of eggs that would turn into abnormal embryos that either won't implant or could result in a miscarriage, and on occasion problems like trisomy 21, Down syndrome, Turner syndrome, etc. With medicated IUI, you're focusing on the here and now. You're just trying to give an extra push to get pregnant now for baby number one, or whatever's ahead of you. You're not saving anything for the future. So that's another contrast with IVF. If you're able to make multiple embryos over one cycle, or even if you do multiple cycles, you're able to freeze them, so it acts like a form of fertility preservation. And this is another reason, if you're over 35 and you want to have more than one child, it could make sense to just go straight to IVF, particularly if you're 38 or older and you want to have 2 or more children. It absolutely makes sense to start with IVF as a first step. The downside of IVF compared to medicated IUI is that it's more work and it's more expensive. It's a high-tech treatment option. We're relying on a whole team of embryologists and a lab. One last point of difference, which is important because a lot of women have low AMH, is if you're able to still ovulate, but you have diminished ovarian reserve, in some cases, there's an advantage to medicated IUI in that the success of that is not reliant on how many eggs are available or what your AMH level is. But when it comes to IVF, the response to stimulation, how many eggs you get at retrieval, the efficiency of IVF treatment is very much tied to how many eggs we have access to in a given cycle. So your ovarian reserve is more of a marker for IVF treatment. It's not a predictor of success with medicated IUI. So that's it. Those are the two main buckets of treatment that I counsel patients about when they're navigating how to proceed once they've been diagnosed with infertility. And of course, the tests that I talked about in my last video are going to sometimes push us in one direction or the other. If your tubes are blocked, we need to do IVF. If there's a really low sperm count, we need to do IVF. But assuming all of these tests are normal or don't have severe findings, then really the choice is up to the patient how they want to get started. It's kind of like a choose your own adventure book. And it's important to understand the pros and cons of each treatment option so that you can make an informed decision on how to get your journey started.